Dr. Amesh Adalja is with us now. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. He's joining us from Pittsburgh. Dr. Adalja, let's start with the efficacy of this Johnson & Johnson vaccination expected to be approved later today. How does it compare to the others? And then what does this mean for our timeline of vaccinating people in the country?
Well, when you look at a vaccine, you have to decide what you want it to do. And what we want with these COVID vaccines are to prevent serious illness, hospitalization, and death. And the Johnson & Johnson vaccine stacks up very well against the Moderna and Pfizer vaccine and has the added benefit that it's a single dose. So you get that protection. Basically, you're one and done pretty quickly after you get that vaccine. And remember, these were not studied head-to-head in trials, and the trials differ between the Moderna vaccine, the Pfizer vaccine, and the Johnson & Johnson vaccine. So I wouldn't compare the raw numbers head-to-head and try to draw any conclusions. This is a great vaccine. It's going to be a huge addition to our menu of vaccines, and anybody that's offered this vaccine should take it as soon as it's available to them.
Doctor, yesterday the CDC said that 10% of cases they believe right now are now variants of this UK variant that was detected. How are companies adjusting as this new vaccine rolls out to the variants that are coming out?
Companies are being very proactive, and they're doing a couple of things. There are some companies that are trying to decide whether or not they can come up with a modified version of the vaccine that better matches these variants. And there are other companies that are thinking about, could we give a third dose of the same vaccine to boost your immunity even further? But remember, we're not across that threshold yet where we need to do something specific about these variants. I think the threshold for me is if somebody gets hospitalized, it's a breakthrough infection, they've already been vaccinated, but we're not quite there yet. And these vaccines do very well against the variants, especially the UK variant, when it comes to what matters: serious illness, hospitalization, and death. And I think we have to keep returning to that. That's what we're trying to do: tame this virus, defang it, make it unable to threaten hospital capacity again. And our vaccines are all very good against all the variants when it comes to that endpoint.
And as more and more people get vaccinated, I'm seeing it. I'm seeing this sort of euphoria of people in the sense we're going to get back to normal and sooner than we may have expected. But you said in Salon this week that you believe there has been an overemphasis on what you cannot do once you're vaccinated. Can you elaborate?
Well, when you see people talking about the vaccine, sometimes they'll say, well, you have to go, and basically nothing changes. And it's not true. Things do change when you get vaccinated. You're basically protected from symptomatic disease. You're very less likely to spread this virus to somebody else. And if you're doing things, for example, if you're going out and maybe you're somebody that's an early adopter of going to indoor dining, you are at very low risk of getting serious infection. And when you're with another person that's vaccinated, you can basically do anything with that other vaccinated person because you're on the same timeline, because you're both protected. And if you're seeing somebody that's unvaccinated, the risk to you is very, very low. So I do think that this does change your life. And I think that people are really often kind of underselling the vaccine, saying, well, this doesn't do this, this doesn't do this. And I think what we're looking at are really tremendous vaccines that are going to be the path to normalcy, that people should be optimistic about them. And if we don't tell people that this vaccine is going to benefit their life, if it's going to improve their life, they're not going to get the vaccine. And I think we have to really think about how we're talking about this vaccine in the media.
Quickly, you mentioned that this notion of COVID-0 is a fantasy. Why?
You have to remember that coronaviruses are part of the viruses that cause the common cold. They cause about 25% of our common colds. This virus spreads like that. It spreads efficiently through the respiratory route. It's established itself in the human population. We will never get it down to zero. The goal, as I said before, is to tame it so that it doesn't cause severe illness, so that it can't hospitalize people or threaten hospital capacity. And we'll get there with the vaccine. But this isn't going to be an eradicable disease, or it's not going to be eliminated. We'll still have COVID cases 5 years from now, but they're never going to be able to threaten us the way they can now once we get people vaccinated.
We certainly hope so. Dr. Amesh Adalja, thank you.